Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. In this brief bonus episode, I asked Dr. Georges Benjamin, Executive Director of the American Public Health Association, about the increasing harassment of many state and local health officials in the COVID-19 pandemic. Let's listen. Dr. Benjamin, thank you for joining me for a quick discussion about this trend that we're seeing with health officers being personally attacked, harassed, aggressive demonstrations right in front of their house, in some cases fired, forced to resign, or just driven out of office. Does this situation have precedent in recent years?
It has no precedent in recent years. In fact, as you know, most public health work is done very quietly behind the scenes, and generally public health practitioners have been well respected. I think this is the tragedy behind the politicization of public health. And I think that has to come to an end. We've got to do a better job of training or educating is probably the better word to use, political leaders to hire the right people and stand behind them when they make these very, very, very tough decisions.
Yeah, what do you think the basic dynamic here is that is leading to this challenge?
It's politicians covering their butts, and it's people not feeling they're supported. Both of us have had jobs in public health. Both of us have had really, really, really tough jobs in public health. I'm assuming you had the same experience I did where, because I know who you work for, and I can tell you that I never, ever felt that my boss didn't have my back. Now, my boss didn't mean my boss was happy with me all the time, but I never felt that my boss did not have my back. And so that was partly because of the way I managed the political relationship, realizing there are politicians. It was important for me never to give them a surprise. I never surprised them. They never got up in the morning and found something in the newspaper they didn't know about. But they always covered me. And if I got yelled at, they yelled at me because I didn't do something right. But it was a relationship that we could work through. And, that's one of our challenges is that far too often, very, very good health officers are increasingly not feeling that they've got their backs covered.
And so they're making decisions, and then as soon as there's a small segment of the public that's upset about it, then the politicians are sort of pointing the finger at the health officer instead of supporting them.
Well, they're cutting them loose. And if you did that with your fire chief and you did that with your police chief, you wouldn't have a fire department and you wouldn't have a police department. Now, I understand when you have a series of, we have a series of problems. And, it is true that the average, for state health officers, the average life of a state health official politically, it's only about 18 to 24 months. But it's happening at a much, much faster rate for both state and locals. It used to be unheard of for a local health officer not to stick around for many years. And now that's a real problem.
Well, I hope that this does change. I hope people realize they're putting the health departments and all the great work that the health departments do at risk. And certainly we'll stand with APHA to push back against the targeting of health officers across the country.
Well, let me just say, the American Public Health Association has their backs if nobody else does.
Well, thank you very much, Dr. Benjamin.
Thank you, Josh.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.